Good afternoon, everybody. The chairman and members of the Presidential Task Force on COVID-19, National Coordinator, the Director General and Permanent Secretaries, ladies and gentlemen. In the past 24 hours, we have recorded 643 new confirmed cases of COVID-19, and this is out of a total national of 199,016 tests done, bringing us a total of 34,259 persons so far confirmed positive, of which 13,999 have been successfully treated and discharged. We have regrettably recorded 760 fatalities, mostly with comorbidities, and a total fatality rate of 2.21%. As the numbers continue to rise in this phase of community transmission, Nigeria, like most other countries, has hardly any other tool left than to focus on the value of non-pharmaceutical measures for prevention. Studies in many countries have confirmed the effectiveness of wearing masks in reducing the risk of COVID transmission, since it provides mutual protection to all wearers. It is therefore still important for us not to give up, but to continue to practice these measures, especially the use of face masks, physical distancing, and imbibing the social etiquettes like not sneezing or coughing into open space, but into a tissue, especially where people are around you. The stated aim, which I will repeat, of the Federal Ministry of Health once again, is to reduce fatalities by ensuring that those citizens defined as vulnerable to COVID-19 are offered protection by prioritizing them for advice on non-pharmaceutical measures like staying home, except for essential activities outside the home, and in such cases, wearing and retaining a mask and avoiding gatherings of persons. Going to places of worship should be if their physical condition permits, and their health condition, and the prescribed arrangements have been made, or else pray at home. The vulnerable will also be prioritized for admission to observation or treatment centers, even if they do not yet have symptoms. In this regard, it does not help for anyone to continue to deny the presence of COVID-19 in our communities, or to test its virulence by engaging in risky behavior. The consequences can be dire. Countries around the world, including even the most liberal in Europe, are now making masks mandatory for people who use public transportation and even those going outdoors. And they are imposing a fine for non-compliance. We urge all shops, businesses, service centers, and places authorized to open to the public to require that their customers and visitors use masks or a face covering, or else be denied entry if they do not adhere to these simple measures. It is also important to state for clarity that masks should cover the mouth and the nose, and we shall get used to the inconvenience that it may cause some persons. A mask pushed under the chin is not effective. It should not be under the chin for any reason. Third, that we need the mask most when we are speaking, and it should therefore not be removed or lowered in order to speak. Fourthly, that wearing a face shield alone has not been proven by tests to offer the same protection as a mask, and should therefore either be combined with a mask or totally left to healthcare providers for whom they were actually intended. The COVID-19 pandemic underscores the fact of close relationship between national security and health. In my capacity as Minister of Health, I addressed participants of the 13th course of the Nigeria Institute of Security Studies on how prepared Nigeria was for the COVID-19 pandemic. It was well received, and the ensuing interaction was useful for mutual understanding. And among the facts shared was that Nigeria was recognized as one of the first globally to initiate COVID-19 response by activating very early a containment strategy, and on transition to community transmission, building up its national pandemic and influenza preparedness and response plan, a national strategic development plan to develop the national COVID-19 response action plan. The collaboration among sectors of government and also with the governed is an essential prerequisite for tackling this virus. The impact of COVID-19 outbreak and the collaboration among ECOWAS nations, of which His Excellency President Muhammadu Buhari is the COVID-19 champion, was the subject of the second conference of ECOWAS health ministers who form the Ministerial Coordination Committee and held a meeting under the chairmanship of Nigeria's Minister of Health. It took place by conference 2 days ago, and the sub-regional strategies were reviewed and the need stressed to improve on the low level of testing and bed spaces, with a resolve to strengthen test, trace, and treatment strategy. It was also resolved to share ideas and also examine the modalities for improving travel and easing sub-regional travel. I shall close by, as usual, reminding all listeners that COVID-19 must not be trivialized and that all citizens must care for themselves, their families, and each other. There is plenty of room for socials. There is presently no room for socials and parties, let me remind you, and also for unnecessary travel. All these we have to wait until further notice. I thank you all for your attention.